All right, hello everyone. My name is Blake Swan, and I'm the Director of Sports Performance and Wellness here at UOA. And we've gone over a lot of the ACL injury and the risk for injury and the process of reconstruction, but now we're going to discuss the process of prevention. I have no disclosures. So the question we're asked with here today is it possible to prevent an ACL injury, both pre and post reconstruction? So in doing so and looking at the literature, most of the literature today really focuses on more so the injury itself and more so the reconstructive process. So there isn't as much that has been with prevention. So our goal here is to look into what has been with prevention and to see if we can find out if there are any concrete evidence to suggest that ACL prevention programming is not only beneficiary, but should oftentimes be necessary for our athletes. So there are many studies that actually show a reduction in incidence of ACL injury after participating in the sports performance program. And of course, this is especially crucial for our most at-risk population, which tends to be young female athletes. And we can see in one example of a study done, there was a great reduction in the risk in between the ages of 14 and 18, with less of an impact post that 18-year-old demographic, which we can really see as that, again, period of puberty where the athletes are growing, and especially for our female athletes, they have a disproportionate rate of growth between their actual size and then the muscular strength. So we can also greatly impact their neuromuscular and biomechanical mechanics at this point. That's really what we're focusing on here. And again, post-ACL, there is the most risk for, again, another ACL injury. So in creating a prevention protocol for ACL injuries, we have to look at a few things. First and foremost, we have to discover a risk assessment. So what are we looking for, okay, and with who and why are we looking into that injury? So what sports are at risk, and then what individuals are at risk based on modifiable and non-modifiable factors. And then when screening for injury risk, again, we need a hierarchy of modifiable changes to note that should we even pull someone from activity based on their risk factors that they are exhibiting. And then again, very important is the transition from therapy to sport. So once you actually have your athlete cleared for activity, the important question is, are they ready to return to sport? And there's a number of factors we actually have to consider here. So we're going to go over a protocol for successful return to play, preventative training strategies, and what strategies we utilize here. So again, we have Dr. Hewitt and working out of Cincinnati, and we see identifiable neuromuscular imbalances, which we'll go over in further detail later. And we see here ligament dominance, quad dominance, leg dominance, and trunk dominance. And if we were to examine our athletes' actual movement, we can actually see the different physical expressions of these neuromuscular imbalances, such as the valgus collapse, and then again, the lack of flexion in the hips and the knee. And then we can see them favoring one leg over the other, as well as any trunk adaptations or tilt. So here we kind of have a summation of what you're looking for, what the neuromuscular imbalance equates to mechanically. And of course, we understand that post-injury is where we're really concerned because the rate of re-injury is very high. So in looking into the screening for risk factors, we can see the non-modifiable ones we already know, the anatomical, hormonal factors, and demographics. Also very important here, unanticipated situations. When dealing with athletes, a lot of times when we work on training them, we train them in a very controlled, static environment. But most often their injuries occur with the unanticipated motions in sport. So it's very important that we're able to simulate those environmental factors in sport when we're trying to train them to get back on the field. Of course, modifiable factors include their skills, their psychological factors, and their physical fitness. Equipment is also very important. But what are we looking for? Of course, we know, as we've gone over today, a lot of the injury factors occur during the game as opposed to practice. Again, dealing with that unanticipated situation. Single leg maneuvers, we know, are much more at risk than our double leg maneuvers. Something we may want to simulate when we're training our athletes to get back onto the field. And then correct positioning. So of course, when we're screening our athletes, we need to find neuromuscular and biomechanical risk factors in static, dynamic, controlled, and uncontrolled environments. And again, look at most of the protocols we have. Most of them are in static, controlled environments. We need to incorporate more dynamic and uncontrolled environments. So here we go again, looking at different things we can see with neuromuscular factors, quad, hamstring strength, and etc. The biomechanical factors are looking at our exhibiting the factors and risk factors for injury. And we see the first image we have here is of proper technique, fairly balanced, flexion at the knees and the hip, and everything's in one line. If we go to the second image, we see that valgus collapse there. And we can also see a slight in the torso as well. And as we go to the third image, that is a side view of proper technique where there's adequate flexion at the hip and at the knee. Chest, knee are still in one line, and the feet are flat. Concerns. If we're looking at an athlete and we're trying to dictate return to play, and single leg maneuvers are much more at risk for injury, we need to actually involve and incorporate screening for single maneuvers. Because if we've done double leg maneuvers and techniques the entire time during the recovery process and haven't examined their single leg, if the single leg looks like the final image instead of the fourth image where we're in good alignment, then we're in trouble. So again, going over what we're looking at, what we can change. And important to note, we have proprioception, muscle activation, and interjoint coordination all incorporated into preventative training. So we can also protect the knee with the brace, which, as Dr. Swan said, may be debatable if you prefer to use it, much more on preference. But all those factors should be incorporated into a recovery training protocol and prevention protocol. And we're going to see how we can adapt them into our protocol. Now, kinesiophobia is another issue we have to deal with when we have our athletes training to get back onto the field. One thing I like to incorporate is especially our that we're using with our athletes, because to look at the studies on psychology, we can see that the terminology you use for your athletes may take a different response. Some athletes do not respond well to the terminology of testing with physical testing. If we incorporate our training a physical challenge without having to tell them, hey, we're going to test you today on this, and elicit that automatic fear response. Often with my athletes, what I'll do is I'll actually have them progress, and if they go through my progressions and I see that they're capable of advancing, then I'll incorporate that challenge to them without actually telling them, oh, this is a specific challenge. It's a task I'll give to them organically and dynamically, and only post the challenge will I actually reflect and say, okay, this is how we performed. This was an examination to see if we can proceed with our programming.
Okay. All right, can you hear me? Okay, that's better. So, it's important to include our mental screening process. So when we're looking for our athletes and how do we quantify our risk, the most important thing is to create an athletic profile. Now, earlier we talked about BMI. Personally, I hate BMI because it's very non-specific towards our individual athletes. When looking at a total population, maybe we can look at that as an important factor, but overall, body composition and seeing if they're actually in shape for sport is very important. Also to include their sports demands, because what they'll need to do and what they're required to do post-injury, a lot of our athletes become deconditioned. Remember, if you guys know, detraining starts within 14 days typically. So it only takes 14 days to start the process of losing everything you gained during the off-season, during your years of training. So it's very important that we actually can look at, okay, what are their current mechanics and skill levels given their absence of movement? Their training aids, their exercise experience and techniques, they have to be all revisited because, again, there's compensations that are also going to be made when you have an injury. Proper equipment, shoes. I had a woman come in once and had knee injuries and often expressed knee pain, had been doing training her whole life, lifting, plyometrics, and etc. And came in and she was wearing running shoes. And I asked her, are those what you typically exercise in? And she said, yes, the whole time. Removed the shoes, decreased the pain. She was able to do movements, hip hinging squats with less pain, no pain. And I asked her, had anyone ever told her to switch her equipment? And they said no. So she was allowed to exercise for her entire athletic career in running shoes, meaning lifting, which, you know, if running shoes put you in an anterior tilted position most often, which makes she had to fight to stay in proper athletic position her entire career, and no one ever asked or checked her shoes. No one ever modified, they just let it go because we're so much concerned with the outcome of performance, not even the process. So that's very important. And then screening selection, we have FMS, single leg squat, tuck, jump, hop test, and of course our psychological screening. And I incorporate the results of our screening into our warm-up so our athletes are always forced to address any imbalances that may present themselves. So going over the FMS, it's very important to understand that this is a tool used to analyze movement. The screening itself is more of a clue. We have to find the mystery of the athlete's body and what imbalances may be present. So it doesn't tell you anything. It's our job to actually analyze the results of the FMS, and we can't exactly be lazy and see, okay, there's excessive trunk flexion, so they have a weak core, which is a very kind of lazy answer. We have to investigate and see what is causing the imbalance, as opposed to, okay, we see this, it's that, we'll leave it at that, and we'll train the core, when it could be something very different. And so now we're looking for a screen for assessment and how we can use a tool such as the tuck jump test. So here we can actually see the different imbalances, neuromuscular imbalances that represent themselves by simple field tests. Again, in a controlled environment, you're not at higher risk for injury. It's very easy to do this test anywhere. And we see ligament dominant where have the valgus collapse, okay? And then we see quad dominance, which is also noted by the lack of hip flexion and the excessive noise your athletes may make when they land. Leg dominance or residual injury deficit. So it's very crucial to notice this, especially pre-injury. If your athlete is landing on one leg versus the other, oftentimes very audible and sometimes very subtle. So you have to be very alert to notice that. And then trunk dominance, core dysfunction, they're unable to maintain proper alignment or they have some kind of rotation added to their assessment. And then we see perfect technique, keeping proper trunk alignment, getting good and equal height with the jump. So again, transitioning from therapy to sport and our protocol for successful return to play. So this is very important for me, especially when I get athletes here. When you're coming back to injury, we have to make sure what part of the season are we turning our athletes to. Because one thing that often happens is we train our athletes like they're going back into the off season all the time. There's no progression for what energy systems they will require, what type of practice they're going to go into. Are they at the repetition level? Are they at an interval level where we're going full game speed and we need to have that energy? We kind of just get them back where they're good enough to go back to sport and say, okay, you're cleared and you've been cleared from therapy, cleared by your doctors, here you go. And a good example is they showed Todd Gurley earlier, and one thing with Todd Gurley is that he was taken out of sport for 4 weeks. And remember, detraining starts as early as 2 weeks, suspended by the school for 2 weeks, and NCAA suspended him for an extra 2 weeks. Now, he came back in sport, had over 120 yards in the first half, 2 touchdowns, returned to kick 100 yards for a touchdown, in the beginning of the second half, third quarter, tore his ACL. Now, we know as professionals in strength conditioning that he was at much greater risk because detraining starts in 2 weeks. He was not allowed to practice or play. So he was at much greater risk for an injury. And it's no coincidence if you actually looked at the insurance policy of school, raised it from around $3 million to $10 million before they allowed him to go back on the field without proper training, getting back into game shape. So that's not a coincidence. So when we look at installing our sports skills, we have the basic skills of pure movement, mechanics, and alignment. Our intermediate sports skills, where we introduce elements of the sport to our athlete, and then our advanced sports skills, which are season focused, meaning if we're going back into season, we need to replicate the practices and the conditions for sport. And here we can see an example of basic skills, acceleration, max velocity, and multidirectional. And we can adapt to sport-specific skills as well. So then what conditioning do we need? Are they need endurance? Is it the off-season intermittent sprints because they're getting into in-season? Muscular endurance, strength, and power endurance. Those are all separate factors we can train our athletes for. And then what kind of events are they going to be participating in? Is it a single explosive event for our athletes, or is it multiple explosive events if we're looking at our football players, for example? And then we can see a competition periodization model for off-season, preseason, in-season, and post-season considerations for our athletes. And we see warm-up routine. We begin with our closed skills, getting an athlete back into sport. Closed skills with the incorporation of open skills. And then finally, if they're getting into postseason, which is the prime of play, we have randomized open skills. That's the most realistic and close thing we can get to getting our athletes back to play in sport. And then here's some different examples of action and cueings we can give our athletes, which I believe are in our handouts as well. And so in looking for preventative strategies pre and post, very simple. Minimum time it takes, 10 minutes to 30 minutes. I prefer the 30. Going from general to sport-specific movements. The volume is depending on the time of the year. That's very important, the volume of work you're going to give your athletes. The frequency, at least 2 to 3 times a week. Intensity is moderate to vigorous. And duration, 8 to 24 weeks. And even in some examples that we'll see soon, we'll see even year-round models to keep our athletes in shape and make sure they're not at risk for injury. Constantly hitting on those mechanics. If we're looking at the keys for prevention and a nice little summary here, I put at the bottom, we have all the information we've gone over several times today. Communication is very key because when athletes get cleared, a lot of times a doctor may clear them, they or their parents may come back and insist they get right back on the field and play. But as I just told you, detraining starts very early. Reinstalling proper mechanics is very important. We cannot just simply say, okay, you're cleared, no considerations, just go necessarily, because you're increasing the risk of injury. And whether they did get hurt or not, I mean, you're putting them at increased risk. And I know there's pressure too because the coaches, the parents, that's why you need communication and say, okay, communication with the doctor. And okay, what did you clear them for exactly? Because we all know parents and kids will lie. All right, so strength conditioning protocol that we use here, we do a functional movement screening and we do field tests, hop tests and tuck jump tests. So we begin with the myofascial release foam rolling, multiplanar movements, and stressing strength in the hamstring, glutes, and the calf. So you can just kind of see the basis of our programming. An example of a tuck jump assessment model here, where we're able to look at the imbalances and just check it off. It's very simple, very repeatable. You guys can take that anywhere at any time. And here's some sample programs. The jump landing training protocol is actually a year-round protocol that was done out of Australia. Very simple, very easy, with distinct phases that you can adapt in no time. If you even want a copy, feel free to email me, message me, and I'll send you a copy of this protocol. You guys can run this anywhere at your schools at any time. All right, are there any questions? All right, well, I guess one last note I will say is the reason it's important to focus on screening and not just function is that Marquise Lee is another athlete. If anyone knows Marquise Lee, he was a top 5 athlete for wide receiver in his position, played at USC, and ended up tearing his knee. Now, when he got through the screening process post-injury, they found out he was a quad-dominant athlete. So he's an athlete that did not properly recruit his glutes when he performed sport. Now, this is a very high-level athlete who has ended up being a top 5 player at his position that no one ever bothered to say, hey, is he functioning correctly? So just because you have high-functioning athletes does not mean that they're exempt from the screening process, and I advise you screen all of your athletes. And again, we have prevention programs we run here, including the ACL female jump program and our Prevent Injury and Enhanced Performance program, our PEP program, and my email is listed at the bottom. Thank you for your time.